Okay, and thank you so much for that introduction, Fanny. Thank you once again for joining the Western Center for Agricultural Health and Safety November seminar. We're really happy to have you with us today. Elizabeth, next slide. I'm going to repeat a few of those housekeeping items one more time. As a notice, this seminar is being recorded, and that does mean that it will be available on YouTube later this week. We have asked and made all participants muted. However, you can use the chat function to submit questions for the question and answer session at the end of the presentation. And as Fanny said, Spanish interpretation is available. To utilize it, you can choose either English or Spanish from the interpretation language selection below. And that's that globe icon at the bottom. If you'd like to hear original language, you don't have to select anything. Closed captioning is also available. Select the CC icon below and select Show Subtitle. All right, Elizabeth, next slide. For those of you who are new to our seminar series, the Western Center for Agricultural Health and Safety's mission is to improve the health and safety of agricultural workers in the West through innovative research, interactive trainings, and tailored outreach. This seminar is one of the ways that we communicate to partners across the region and the country about research happening out here in the western part of the country, from researchers, community partners, governmental officials, and others about important trainings, innovative research, and really important policy matters. And so today we have a new member of the academia who's joining us today, and we're really excited to hear from her. Next slide. All right, so today we're going to learn about some strategies for mitigating climate-intensified exposures among agricultural workers. So we have Dr. Carly Hyland, who is a new Assistant Cooperative Extension Specialist at UCANR, that's Agriculture Natural Resources, and UC Berkeley. And so Carly, I'm going to hand it over to you. We're really excited to have more extension specialists focusing on farm workers and their health and safety. And we're really excited to learn about the work that you're proposing to do in California and how we at the center can partner with you on this work. And so really looking forward to hearing about the work you did in Idaho and the proposed work that you have in the future.
Awesome. Yeah, thank you so much. I'm really excited to be here. If you could, stop sharing, then I'll start sharing my screen. Awesome. Thank you all. Yes. So as Heather said, I'm a new cooperative extension specialist housed in the School of Public Health at UC Berkeley in environmental health sciences. And so my position is, what I'm really charged with is both identifying and translating strategies to protect agricultural workers and food systems workers from interconnected climate-intensified exposures. And so I always like to kind of start out talks by giving a little bit of background of why I'm so passionate about what I do. And so I am from Wisconsin originally. I went to a really small school there where I was studying environmental science and had an opportunity to, I worked with a Spanish professor who had connections to this community in Guatemala. And I designed an independent research study, really, from an environmental science perspective, in which I aimed to look at nutrient levels in the soil of different agricultural plots in this community. And I, went down there over the summer, and the very first day I was out in the field with the farm workers, I took this picture on the left and saw that they were, applying pesticides with really no protective equipment at all. You can see they're not wearing gloves. You can't see their faces, but they weren't wearing masks. And they would tell me they would feel physically ill after applying pesticides, but didn't feel like they had access to resources to decrease their reliance on pesticides. And that's when it really clicked for me, like, oh, this is what I'm meant to be doing, looking at kind of the impacts of these exposures, not just on the environment, but on human health. And how do we look at, the systems that are preventing this essential population from adopting behaviors to protect themselves. And so just briefly, a little bit more background, just so you can see where I'm coming from. I did my master's and PhD at UC Berkeley in environmental health sciences. My graduate work looked predominantly at the health effects of exposure to pesticides during pregnancy and neurobehavioral outcomes during adolescence. And then I was finishing up my PhD in 2021 in kind of peak COVID, and like a lot of people, was doing a lot of self-reflection of the things I had learned and what else I wanted to gain and really where I wanted to go in my career. And one of the big things I was feeling was that I worked on this amazing community engaged study that had been responsible for, shifting policy and practices and changing, banning certain pesticides that were really harmful. But I felt like my personal role in that work was often quite extractive. I felt like I was doing a lot of work in which I received data from a structurally marginalized population and I published papers, but didn't really have any direct impact with the community, and was also feeling like I, understood that scientific evidence was important for informing policy, but I was feeling a little bit like that process can be quite slow, and I wanted to kind of have a little bit more of a sense of urgency in my work. And so I went to Boise State University for my postdoc, and my primary goals here were really to gain better expertise in exposure assessment. I realized a lot of the studies we do are not always using kind of gold standard exposure assessment methodologies. I also wanted to gain experience in conducting intervention studies with kind of the idea that, I was hoping to try and see, okay, how do we intervene to reduce exposures and mitigate adverse health impacts, and kind of not sidestep the observational study process, but realize that, a lot of these exposures are not beneficial. And so what can we do to try and intervene in the meantime? And then primarily, I really wanted to get experience in community engaged research. And so one of the first projects that I worked on in Idaho was an examination of glyphosate exposure among pregnant individuals. And so glyphosate is the most widely used herbicide in the world and has been associated with adverse birth outcomes such as preterm birth and shortened gestational length. However, we still have relatively little information, not just on levels of exposure to glyphosate in human populations, but also the primary sources of those exposures. And so we did a study in which we recruited 40 pregnant individuals from women, infant, and children clinics. We intentionally recruited half who were living within half a kilometer of an agricultural field, so kind of near field participants, and half of the cohort from those living farther than half a kilometer from an agricultural field, so far field participants. And we collected weekly urine samples from the time the individual was enrolled between February and May until the time the individual gave birth, and participants gave birth between August and December. And then the part that I led within this study was that in June, during the pesticide spray season, we led a 2-week organic diet intervention. And this allowed us to kind of disentangle impacts on exposure from living near an agricultural field and nearby agricultural spraying and diet. And so of the 40 participants in the larger study, one was unavailable during the organic intervention period. So we had 39 participants here. Every participant received 1 week of fully conventional groceries and 1 week of fully organic groceries randomized to order. Participants ordered directly from an online grocery shopping system from a local grocery store. And for most participants, the food was delivered directly to their houses. We also had some participants living in quite rural Idaho. And you can see that I received the participants' food then and distribute it directly to their homes. And during this period, we collected daily urine samples and we composited those urine samples. So one sample representing the organic week and one sample representing the conventional week, and analyzed them for glyphosate concentrations. And so just briefly, I wanted to show this plot where you can see the difference in urinary glyphosate concentrations between the organic and conventional weeks. And so on the far left side of the screen, you can see all 39 participants. The red dots below the line indicate those for which their glyphosate concentrations were lower during the organic week, so kind of as we would hypothesize. And the blue dots above the line indicate individuals for which their glyphosate concentrations were actually higher during the organic week. And so then you can see in the next two columns that we also separated or stratified our results by those living near or far from an agricultural field. And you can see for those living far from an agricultural field, which is representative of most of the American public living in more urban areas, the organic diet intervention was very effective at reducing glyphosate concentrations. However, for those living near an agricultural field, the dietary intervention did almost nothing to their exposure. And while there are certainly, a lot of discussions to be had about the affordability and the accessibility of organic food, I think this is notable because it is an individual level modifiable behavior, whereas for those living near agricultural fields, these data really suggest that nearby agricultural spraying may be a bigger source of exposure, which is something they don't have a lot of control over. And I also just wanted to show this. This paper was just accepted in Environmental Health Perspectives and should be out in early December. That we did consistently see higher glyphosate concentrations among those living near to agricultural fields, and particularly during the spray season, which is the red box plot in the near field participants. So again, suggesting that for those living in agricultural areas, nearby agricultural spraying is a much more important source of exposure. So after working on this study that my mentor led, I had an opportunity to design my own research study and received funding from the Pacific Northwest Agricultural Safety and Health Center. And I was really interested in looking at farm worker health. And so, as many of us know, the agricultural workforce in the United States is predominantly Latinx. And studies have really consistently shown that farm workers have higher levels of pesticide exposure than the general public. However, few studies have looked at both quantitative measures of farm workers' exposure to pesticides, as well as qualitative assessments of farm workers' perceived risk and control to mitigate pesticide exposure, which is really important information to try and address this issue more holistically. And further, previous studies have really focused predominantly on men. And previous work from our group had looked at specifically the health and well-being of Latina farm workers in Idaho, and found that Latina farm workers faced disproportionate challenges such as economic discrimination, sexual harassment, inequities in childcare and domestic responsibilities, as well as less secure employment and social isolation. And further, both in the United States and globally, women represent an increasing proportion of the agricultural workforce, undermining or highlighting the importance of looking at this population. And further, again, data both in the US and globally indicate that women may experience higher rates of acute pesticide poisoning, so really high levels of pesticide exposure associated with acute effects. And so we were curious if this also correlated with women having higher day-to-day or chronic exposure. And so we had a few hypotheses as to why this might be. If women indeed had higher pesticide exposure, We thought perhaps there were differences in access to properly fitting personal protective equipment. A lot of PPE is made specifically for men, and we thought maybe women weren't getting access to properly fitting PPE. We also thought perhaps that men were preferentially being sent to pesticide safety trainings, or perhaps there were differences in risk perceptions and perceived control by gender. And so we conducted a study with three main aims. The first was to examine urinary pesticide biomarkers and assess whether there were differences between men and women. The second was to qualitatively examine risk perceptions, perceived control, other protective behaviors that farm workers adopted, and again, whether there were differences by gender and whether these perceptions and behaviors were associated with pesticide exposure. And the third was to communicate our findings back both to study participants individually with their individual level data, as well as our partner community organizations. And I just want to acknowledge the incredible study team. I was the PI of this project and was mentored by my mentor in the School of Public and Population Health, Cindy Curl. This work also included Lisa Morado and Rebecca Sam Castellano, who are qualitatively trained. A student who is now a Master's of Public Health student, Alejandra Hernandez, was really pivotal in all of our data collection and fieldwork. And we also included Irene Ruiz from the Idaho Organization of Resource Councils as a paid partner and true research partner on this grant. So this pilot project was a 1-year project, and we really spent the first 6 months of it developing collaborations with different community organizations. So I already mentioned IORC. Another organization we worked really closely with was the Community Council of Idaho, as well as Latinx Farmworkers of Southern Idaho. Latinx Farmworkers of Southern Idaho is an Instagram and Facebook group that shares stories of farm workers, and I really highly suggest following them and checking them out. And in order to recruit participants, one of the primary things that we did was work with local housing authorities who gave us permission to actually just go door to door and knock on doors and see if there was a farm worker living there and tell them about this study and see if they might be interested in participating. We also reached out to potential participants at events such as mobile health clinics, food distribution events, farm worker appreciation events, and also used snowball sampling. And so one of the things that our team was really aware of is that research takes a long time, especially we were collecting urine samples and then had to wait for them to be analyzed for pesticide concentrations and then analyze the data. And that can feel, I think, really disengaging for study participants. And so we were thinking of ways that we might be able to provide a more immediate benefit to potential participants. So we got permission from some local housing authorities to hold data collection events there where we served hot food and provided food boxes. Notably, individuals didn't have to participate in the study to receive these. They could simply just come by and hang out, get some food, and it was totally up to them if they wanted to be in the study or not. We had also heard from previous work that childcare was a really big burden, particularly for women, and so we offered childcare at study events. And then I also went out with the Community Council of Idaho to help distribute cold water and electrolyte drinks at fields. So for the procedures for this exact study, we asked participants to complete 2 study visits within a 7-day period. The reason for this was so that we could collect 2 urine samples, which we composited for analysis in order to get a little bit better of an idea of their exposure over a 1-week period versus kind of just this snapshot in time with 1 sample. We also administered a questionnaire to all 62 participants that looked at things like their occupational history, their recent pesticide applications at the field where they worked, and their use of PPE. And then we also administered qualitative open-ended interviews with a subset of 18 of these participants to more holistically get at factors such as their pesticide risk perceptions, perceived control, protective behaviors, and barriers to adopting protective behaviors. And so these are just the different specific pesticide metabolites that we analyzed samples for. The key here is that we looked at a number of organophosphate and pyrethroid insecticides, as well as a few herbicides, including 2,4-D, dicamba, and glyphosate, which are really widely used herbicides. Overall, our study population was almost entirely born in Mexico and reported less than a $50,000 household annual income. Participants in our study had a pretty high level of experience and had worked as a farm worker for over 10 years. About a quarter of the population was working in the United States under an H-2A visa, and most lived with other agricultural workers, which could be another potential source of pesticide exposure. We asked participants about various different behaviors, and we found that men were significantly more likely to be pesticide applicators. This is consistent with a lot of other studies. And we also found that women were more likely to wear certain types of protective equipment, especially things like masks and gloves. When we asked participants why they didn't wear PPE more often while they were working, one of the most common responses that we got was that it was too hot outside, which makes a lot of sense. And this response was more common among men. We saw that men and women had pretty similar levels of reporting having attended pesticide safety training. And we also saw that women were slightly more likely to self-report ever having experienced an acute pesticide poisoning. And some of the symptoms they reported, including headache, nausea, vomiting, chest pain, and one even reported having experienced a miscarriage. So overall, our population had a relatively high level of work experience, but we did see that men worked significantly more hours per week than women. And we also saw a few differences in the types of tasks they were doing. So men were a little bit more likely to do things like drive trucks and operate machinery, and women in our study were slightly more likely to be involved in crop maintenance, such as weeding. Overall, looking at the pesticide levels, we saw pretty high levels of detection of almost all of the pesticide metabolites. And overall, here you can see we saw very strikingly similar levels of these biomarkers between men and women. One of the big overarching things that I took from this whole study was that we found that pesticide applicators in particular often reported some perceptions of the risk of herbicides that was really inconsistent with training from the worker protection standards. So we had a number of participants, and again, primarily applicators, tell us that they had heard that pesticides was synonymous with insecticides, and that any other type of substance used to control pests, like an herbicide or fungicide, was inherently less dangerous than insecticides. And this also appeared to influence protective behaviors, such as reporting lower use of wearing PPE while applying herbicides. And this, perception appeared to stem from training that they had received at work, which is fairly concerning because this is really in conflict with required WPS training, which indicates that each pesticide product has specific, PPE requirements and safety requirements as listed on the pesticide label, which, often workers do not have access to or is only available in English and really highly technical language. So this is something I'm interested in exploring further, is kind of where is this perception coming from? And again, this appeared to maybe influence both protective behaviors and actual exposure levels. And so you can see here, particularly for 2,4-D, Pesticide applicators had much higher levels of exposure than non-applicators. So again, this is pretty concerning and deserves further exploration. We also noticed some differences in gender, both in terms of pesticide risk perceptions and behaviors, as well as the potential impacts of climate change by gender. So we saw in both our surveys and open-ended interviews that women were more likely to adopt protective behaviors. And so you can see a participant here saying, yes, I think that men are less careful than women. We protect ourselves with hats and all that, and men don't give it as much as importance. I think maybe they think it won't harm them. I've seen men working without gloves and other types of protection. Further, we observed some indications that women had more precarious employment. So when this study happened, the agricultural season was really delayed due to unprecedented precipitation and cold temperatures. And when we were attempting to enroll participants, we noticed that women were significantly less likely to have work. If there was work, men were really preferentially being called in. And we also learned from talking with participants that women were really kind of willing to put up with anything to keep their job. So you see one participant saying, so for women, it's so easy for us to not say anything, not to complain, because we're out there all alone and we want to keep our jobs and we'll handle whatever we have to handle in order to keep those jobs and feed our family, and that's not okay. We also saw some indications of kind of interactions of heat and pesticides and the impacts of climate change. So again, with the delayed agricultural season, this participant is sharing their perception that once the season started, in order to kind of catch up and gain time, they felt that they were applying more pesticides. And further, you can see this participant saying, what worries me the most is that we are going to be poisoned from pesticides. We don't wear masks because of the temperature and the sun. So some of my key takeaways from this overall project were kind of some differences in exposure and vulnerability among women and indications of disproportionate impacts of climate change on women. So we saw that women worked significantly less hours, had greater or equal levels of PPE use, and were significantly less likely to apply pesticides. However, they were more likely to self-report having experienced an acute pesticide poisoning and had very similar levels of biomarkers of exposure. So some, remaining questions I have are there differences in the training men and women are receiving? Are men more likely to have the pesticide applicator training? And so maybe that's informing some of their behaviors. Are there differences in just biological susceptibility to pesticides? And then are there differences in the types of crops that men and women are working on or the types of activities they're doing? And so anecdotally, we heard a lot of women indicate that they had been poisoned by aerial pesticide spraying, being in or near a field that was being sprayed aerially. And so perhaps women are more likely to work on crops that are sprayed aerially. Again, a lot of questions here, I think, that I would like to explore further. One of the other big takeaways that we took from this project, and this wasn't even one of the primary goals, was to look at training. But we just heard from the interviews and surveys a lot of indications that WPS regulations were pretty poorly enforced and that they were often insufficient to address participants' concerns, even when they were properly enforced. So some of the biggest things that we heard in terms of enforcement were lack of access to clean hand washing stations and bathrooms, as well as inconsistent notification of application of pesticides. We also heard indications of inadequate provisioning of PPE for pesticide applicators. And as I mentioned, we heard multiple cases of people being in or near fields during aerial pesticide spraying. In terms of the kind of sufficiency of WPS regulations, We heard a lot of concerns about the quality of the training they received. So one of the approved EPA mechanisms to provide this training is a video, and participants reported that that wasn't very engaging. They'd really like more interactive and in-person training. Participants also had a lot of concern over pesticide drift and would like to know more about not just when pesticides are sprayed at the field where they work, but also if they're sprayed at nearby fields. And they reported, being able to smell and being exposed to pesticides that were used at different fields. One final project, completed project that I want to talk to you about is this farm worker storytelling project that we conducted this last summer. So there's a lot of increasing evidence that storytelling compels collaboration and action better than kind of just spewing facts and figures at people. And so we collaborated again with IORC as well as a filmmaker at Boise State with the goal to do a digital storytelling project with farm workers to create a short documentary and art installations. One of the really primary goal of this whole project was really to humanize farm workers and kind of highlight their experiences. And then secondarily, we wanted to understand their perceptions of climate change and also just educate people about where their food comes from, because a lot of the general public isn't aware of the steps that it takes to get food to their table. So one of the biggest things that we really heard from this project was around heat, both personal experiences with heat, other farm workers, hearing of others fainting or passing out from heat, and also really that they had limited control to adopt protections to combat heat. And so you can see this participant is saying, they're working all day and it feels like they can't take it anymore. They have to be out there working because of their needs. And you can also see this participant saying the opportunities to cool off are very low. Very often you are in a place where there's a tree nearby, but not enough for everyone to sit by. The breaks, they're not that long. It'd be great if we had more breaks that were paid, but maybe you get like a paid 15-minute break and then you get an unpaid 30-minute break. And a lot of people, they would not want to take that break to get that money. So we heard this really consistently that people would not choose to take additional breaks if they were unpaid because they had to support their families. Another thing that we heard, and again, I think it's important to remember that this study was done in Idaho, was this sentiment that, things are changing all around them. They already have, no rules or standards in place to protect farm workers, and they're just expecting farm workers to go with the flow. We're still expected to do this work without getting any kind of help or assistance or aid at all, even though the world around us is changing. So this idea that climate change is constantly making things worse, and they already have very few protections and nothing is changing to help them combat climate change. We also heard statements regarding lack of control and lack of decision to really even engage in farm work. And so we heard one person say, it wasn't really a choice. I think a lot of us who are farm workers do it because we need to support our families and we need to put food on our tables. And we also heard a lot of statements about people starting farm work very early as a child. And this person said, sometimes you have no choice but to take your children to the fields. I was 10 when I started working, and I know that's young, and a lot of farms, even kids start working at a young age. We also heard a lot of experiences with psychosocial stressors that really were unprompted from us. The interview guide included questions about kind of, their experiences with climate change, what they wanted people to know about their jobs. And a lot of people brought up experiences with, racism, discrimination, fear of deportation, and family separation. And I think that those just really undermine how, if you're looking at, environmental and occupational exposures among farm workers, you really can't separate those from these kind of ever-present psychosocial stressors, which are also impacting their health. And so specifically regarding health services, we heard one person say, it'd be great if we had access to health insurance. So when we felt sick, instead of complaining and being like, you know what, I've had a stomach ache for days, let me go check it out. But I'm still here because I need the money. I can't afford the doctor visit. The doctor visit is going to be more costly than me coming here and working and possibly fainting, right? So it'd be great to have that. And especially for mothers, it'd be so great to have that paid maternity leave. And we also heard another participant talking about how their parents never used to go to checkups or get, routine things like vaccinations because it was all out of pocket for them. So now that I have talked about the work that I have done, all of this has really helped inform what I aim to do moving forward. And I know the goal of the presentation was to talk more about completed work, but I just wanted to talk a little bit about some of the work I foresee going forward and really extend an opportunity to anyone to contact me. I would love to work with you and hear, the experiences that you're hearing from farm workers and how we might be able to collaborate and work together. So looking at my future here, I just started here in July, and I'm thinking a lot about how I'm framing not just my research, but also outreach. Like, how are we going to take those research findings and make sure that it results in change in programs and policies and practices on the ground? And so the way I see myself in this position is really a liaison, connecting research with local stakeholders to identify the most effective interventions and then implement and evaluate and scale up those interventions to protect agricultural and food systems workers from interconnected climate-intensified exposures, both inside and outside of the workplace. So just like we heard, and like all kinds of studies have shown, including work done by a lot of folks on this call, you can't just look in the workplace. You have to think about, when they go home from work, if they don't have air conditioning, they cannot get reprieve from all of the, heat and wildfire smoke. And so I think we really need to think about systemic, workplace, community, and residential interventions. And so this is kind of another way of looking at that, is kind of all of these, different environmental, situational, residential, and workplace exposures, and how they're all interconnected and often work together to exacerbate the impacts of something else. And so, these are just some that I have included. This is certainly not an exhaustive list, but again, getting at the idea that you can't disentangle these exposures and their impacts on farm worker health and well-being, and you have to look at this situation really holistically. And so one of the things I'm particularly interested in is kind of the interactions of pesticides and heat. So as you could probably tell from this presentation, most of my work to date has looked at pesticides, but I am really moving forward interested in looking at heat, as well as how climate change and heat is changing exposure and vulnerability to pesticides. And so you can see a map here looking at the most intensive use of pesticides in California. And it's basically the same map where you look at where the heat is most intense. And again, you could overlay a number of different exposures on this. You could map out air pollution in California and it would look just about the same. And so getting at this idea that we have to look at these exposures together. And I have a couple ideas about how I think climate change is impacting pesticides. So from the perspective of looking at pesticide use and exposure, I think that climate change is changing what pesticides we're using and the intensity at which we're using them. And that as pests change range, or the efficacy of pesticides changes, as temperature increases, that we're using more pesticides to achieve the same effect. I also think that this is increasing actual exposures directly to farm workers. So as heat increases, the volatilization of pesticides increases, and this could be changing, airborne concentrations and increasing pesticide exposure via inhalation. Additionally, so that was kind of pesticide use and exposure. And once that happens, I think that climate change and heat is also changing pesticide vulnerability. So I think that as heat increases, the body's ability to metabolize and break down pesticides and other environmental chemicals decreases. As we saw, in some of the quotes that I shared here and also in other studies, there's a need for increased use of personal protective equipment to combat the effects of pesticides, but this can increase the risk of heat-related injury. And one of the things I took away from the work that I did with farm workers was that heat appears to be a much bigger and more acute threat to their health. And then additionally, there could also be interactions with other climate-intensified exposures, such as wildfire smoke, drought, other extreme climate emergencies. So looking at some of the research that I'm thinking about doing right now, one of the things kind of broadly that I would love to do is either conduct focus groups or engage with other researchers and community organizations that have done focus groups with farm workers, growers, and community-based orgs in order to understand what are your greatest concerns related to climate change. What are ideas that you have to mitigate this? I'm very uninterested in developing interventions and ideas from solely an academic perspective. I don't think that those will work. And I think you need to engage folks with lived experience in order to truly get at the root causes of issues. One project that is in the proposal phase right now is looking at pesticide exposure among pregnant and breastfeeding farm workers and evaluating how medical providers support paid disability leave or work accommodations for farm workers as a way to reduce their pesticide exposure. There was just a story in the 19th last week, shown in the picture on the right there, talking about this project. I'm in potential conversations about doing an evaluation of the Ag Card program in Sonoma County, which allows farm workers to come back in during an emergency wildfire evacuation event. And I would really love to talk with farm workers and understand, are you given information about the potential impacts of wildfire smoke? Do you have access to health resources if you're working during a wildfire event? And I think that this is really timely work as statewide legislation is currently in the works to kind of scale up this program more widely. And finally, really where my primary interests lie are looking at interventions to mitigate interconnected climate intensified exposures, primarily heat and wildfire smoke among agricultural workers. And again, looking at both kind of like workplace interventions and those outside of the workplace to make sure we're getting at the issue holistically. And here I would like to thank the funders that supported this work, primarily the Pacific Northwest Occupational Safety and Health pilot grant out of the Northwest Center for Occupational Health and Safety and the St. Luke's Fund. And I will take questions now, and I truly mean it when I say that I would love to work with you. So please do email me any questions or, follow up with me to talk about ways we might be able to collaborate. I think there's not a single person who can address this with, their own ideas. And I think we need diverse perspectives to get at these really challenging issues. And so would love to work with you all. Thanks so much.
Awesome. Thank you so much, Carly. It's really exciting to hear about all the great work that you've been doing, and I just feel so thankful to have you here locally and as a new partner for our center. I'm thankful that our colleagues up in Washington sponsored your work previously, but I'm selfishly really thankful to have you more locally. So we definitely already have some thanks coming in to you for your presentation, and a question that I also had related to the WPS, and it looked like there was high rates of training, so that's a good thing, but maybe less so on the preventative behaviors, and still a lot of issues that workers experienced related to pesticides. So one question that we received has to do with the knowledge retention, the understanding of the trainings that were received. Did your survey and your research look at whether or not workers understood the training that they received?
Yeah, that's a really great question. And I'll also say WAVA was one of the very first people I worked with as a graduate student. That is not something we specifically assessed in this study. However, I think there are indications from our findings that there was not necessarily a high level of understanding of the material. First of all, workers told us directly that they didn't find it engaging. They didn't really like the training. They wanted better and more interactive training. And we also just kind of looking at, yes, Weba said language barrier 100%. And I think in California, that's something that's talked about a lot more, and that it's not just English, Spanish. There are a lot of farm workers whose primary language is an indigenous language, and we need to be thinking about that as well. We also did see in some of the responses with kind of risk perceptions and actual behaviors, some indications that maybe folks understood that pesticides were dangerous, but they still perceived pesticides to present a greater threat to other farm workers' health than to their own health. And that's been pretty consistently shown in other literature. And with the recent UC Merced study in California, I think there are indications that there are gaps in understanding WPS training, even if it is administered.
Right. Okay, thank you. A question from folks at CDPH who would like to connect with you. So we can make sure to facilitate that. But question about the health impacts of drought and floods. And can you talk about what's known about potential pesticide exposure associated with flooding? Unfortunately, with our frequent drought to flood experiences here in California, that's certainly a concern.
Absolutely. And I think this just highlights how many interconnected concerns there are. This is not something I specifically know a lot about. And, perhaps there are even others on the call who could answer this question better than I could. But definitely a big issue. I could imagine that with flooding, there would be runoff and contamination of additional sources of exposure to pesticides. But yeah, definitely something I'd love to connect with you about.
Great, thank you. All right, keep it coming, folks. I know there's got to be a lot of questions and opportunities for collaboration. I know that Carly and I had a chance to meet last week and are interested in really putting into place some ideas around testing strategies for, and working with community partners around outreach and communication, and really working with partners in communities around what works, what topics are they interested in, and how do they want to consume the information and learn from the information, and often knowing that just the do this messaging isn't what is needed. Farm workers are experts in their communities and in their work, and so oftentimes they want, what we've learned and heard from our community partners is they want to understand the why and the how and the where, and so really working on some of those messages with them. And so I'm hoping, one of the things I'm hoping to do with Carly is to build projects that can both develop those resources with our community partners, but then work with Carly to help evaluate them and see what is working towards that positive change.
Absolutely. Yeah, and one of the things, you and I chatted about how there was, the message water rush shade has been well received at this
That's
point.
right.
But what does that mean? And also, what are the implications of that? And so one of the things when we were kind of looking at WPS compliance in this project was, what does access to bathrooms look like? And again, this is something I've heard consistently from community partners and all kinds of different, contacts and locations, is that farm workers often don't have access to clean, safe bathrooms and, don't feel comfortable using those. And so if your message is drink more water, well, what are the downstream implications of that? And again, that's why I think it's necessary to engage folks with lived experience and different perspectives and not just develop these ideas in a vacuum.
Oh, and wonderful. Let me find you, Naomi. I see your hand up, and I would love to hear your reflections on these topics. So I'm going to allow you to speak. Go for it. I think you have to unmute.
I did. Can you hear me?
Yes, please go ahead.
Yeah, well, sadly, I have a very frustrating experience just not long ago at a meeting where we had with people from DIR and Kalush and others and other CBOs. And one of the things that they told us is that, well, we were asking, how do they determine when they go and do inspections? And bottom line was that dirty bathrooms was not at the top of the priority, that was like, depending on the staffing and all that. And at some point I said, well, I disagree with your assessment of dirty bathrooms not being a priority, because recently I had also heard from farm workers, female farm workers, that they were holding to go to the bathroom because they were very, dirty. That had led to constant urinary infections, and because they do not have health insurance, they go untreated, which we know is going to cause down the road other health problems. And one of the comments was like, well, urinary infections are uncomfortable, but they're not going to die from them. So yeah, that's not going to be our priority. If there's an amputation or a life-threatening condition, then we will go. And I think that to me is like very insensitive. Like, who would like to have to deal with being in a job that doesn't guarantee something as simple as, going to the bathroom? And as Carly was saying, if you're asking them to drink water so they are not dehydrated, but you don't guarantee the same access to a clean bathroom, then we're failing them. So I think we all need to be making the point, especially you researchers, of what are the health implications? That it's not just like a minor nuisance. This is an important thing that could lead to very serious health problems, and that they need to take it more seriously.
I think you're totally right, Naomi, and I really appreciate you sharing that and also being in the spaces to advocate for this. And I think one of the things that reminds me of, and I was also talking last week with some medical providers who, again, are trying to extend disability leave for pregnant farm workers to avoid pesticide exposure. And the doctor I was talking with was telling me, I've been very unsuccessful in this. And I think one of the issues is that the other doctors I'm talking to are mostly like myself, who are, have never worked a day in the fields or doing physical labor and don't understand what this really means. What are the health effects? What are the dangers? And so one of the things I'm thinking of is, how do we most effectively do this messaging? I'm trained to write papers to other academics, and that's clearly not the solution. That's not the most effective way to truly get the public to care about these issues. And so, yeah, one of the things I'm interested in is kind of this digital story-based media and other ways to get folks to care about this and kind of understand the importance and urgency of these issues. And again, especially welcome collaboration there, because that's not my area of expertise, but something I'm really interested in moving into.
Thank you, Naomi, for sharing. And as always, we consider CCEJN a valuable and important partner in bringing these important realities to light. So thank you again, Naomi. I see that there's more work for us to be doing on the research front to bring these realities to light in a way that will be heard and respected by additional authorities. We have about 2 minutes. If anybody else has a comment they'd like to vocalize or to put into the chat, we welcome either. Okay, actually, we have another one. So as California is moving toward integrated pest management, they think it would be cool to see a study or to study farm workers' perception on alternative agriculture and new technologies. So we are seeing lots of new technology moving into agriculture and a lot of changes in what pesticide use is allowable. And so how are you thinking about that?
Yeah, and not just kind of IPM and technology, but also climate smart ag more broadly, which I think is definitely, I mean, that has to be part of the solution. I think where I look at this is those are definitely areas of interest and maybe a little bit less my expertise, maybe an area where I would like to engage, but I'm probably not the right person to lead those efforts. But in the meantime, you know, technology is never going to replace human-centered agriculture. And so I think that's kind of where my expertise and interests lie best is, you know, how do we protect farm workers in the meantime until some of these solutions are developed?
Wonderful. Well, I'm going to take this opportunity to say thank you so much, Carly. We really appreciated your presentation and want to thank everybody for joining us today. As always, we really appreciate this space for bringing together researchers, community-based organizations, and officials, policymakers, industry folks, everyone who is involved in agriculture, because we want to foster conversation, identify priorities, and continue looking for opportunities to make agriculture safer for everyone who works in it. We will be meeting again in December, let's see, on December 4th, it looks like, and we hope you will join us. It will be our last seminar of the year. And so once again, Carly, thank you so much. Please feel free to reach out to her if you are looking for collaboration opportunities. And I know that she will be active in future center activities, and she just put her email into the chat. Thank you once again and have a great afternoon.